What does a hospice nurse actually do? When someone hears the word hospice nurse, most people immediately think that it's someone who is sitting at a dying person's bedside. And although some of that is true, the reality is much different. I've cared for thousands of patients under hospice care, and I'm here to tell you a little about what it's like to be a hospice nurse and what we do. I'm Jennifer, and this is my channel, Beyond the Bedside with Jen. I've been a registered nurse for 23 years, and of those 23 years, a decade of that was spent with the privilege of caring for hospice patients and their family members. Most of what I did as a hospice nurse was educating family members, most of all, but of course my patients, educating them on what to expect with their specific disease process, as well as what to expect with the dying process. I also educated them on their medications, not only their medications specific to their disease process, but medications that were used for symptom management, for anxiety, pain, nausea, shortness of breath. A lot of those medications, patients didn't necessarily come to me as a patient with them, and therefore as part of admitting to hospice, those types of symptom management medications were delivered to them or provided to them by the hospice agency that they chose. As a hospice nurse, I provided tons of emotional support. Some days I felt like I provided more support to family than I actually did to my patients. I helped ease fears, terrified family members at 2 a.m. It was always my goal to be the calm energy, the calm presence for them in the middle of a crisis. So lots of emotional support. Also helping them to make decisions, important decisions, like what funeral home they were going to choose. You don't realize it, but as a hospice patient or as a caregiver taking care of a hospice patient, those types of decisions do need to be made. And a lot of times we, as gently and as softly as possible, had those conversations prior to our patients dying, passing away. There were many moments that I was an advocate for my hospice patients. I can recall multiple situations where I was with hospice patients who were receiving palliative chemo and may have made the personal decision to stop that palliative chemo, but were scared to bring that up or have that discussion with their loved one for fear that they would appear like they were giving up. And it always seemed as if our caregivers were worried about our patients and our patients were worried about our caregivers. So there was a lot of advocating on behalf of my hospice patients, sometimes being the voice for them when they just didn't have the energy, they didn't have the emotional capacity to have those delicate conversations, or to at least open the window to the caregivers and patients having that conversation together. So with this channel, I intend to explore not only just these topics, but additional topics, and to definitely go into more depth on each one. Again, if you've seen some of my previous videos, all of maybe two, my goal is to build a community of caregivers, patients, and even seasoned hospice nurses or new hospice nurses, and come together, share experiences, share stories, and just be help for one another. My goal is that not only do people become educated on hospice as a whole and the wonderful benefits to hospice and palliative care, but that this channel helps to remove any fears or any anxieties related to a family member or someone admitting to hospice. And because you're on hospice does not mean that it's the end. It doesn't mean that you're giving up. It doesn't mean that you're dying today or tomorrow. It's helping people learn how to live in what may be their final days or months or years. Yes, years. I've had hospice patients for a few years. But helping them learn or realize that they can live comfortably and meaningfully for as long as possible. So if you have found value in this video and you or someone you know is currently going through hospice or palliative care and you feel like they could benefit from this information, please share this channel, share this video with them. And I would love it if you would like the video. You know how YouTube is, the more views and more likes and shares, the more they'll put this video out there. And I'm not trying to be a content creator. I'm just trying to be a nurse who shares the experiences and the beautiful moments that I was able to experience as a hospice nurse, because I treasure those days. I treasure each and every patient that I cared for. And I have so much experience and so much to share with others. And I really think that it could be a benefit to so many people. So thanks for being here, and thanks for making it this far in the video if you did. And I appreciate you watching. Enjoy the day, enjoy this day as if it were your last, because tomorrow is just definitely never promised. So thanks.